Hello, welcome to Kaiba Health and Life. I'm your host, Kristen Wolosinovich, here with my beautiful co-host, Lisa Metropolis.
Hi.
So wow, I'm lucky today. Look at this,
Look at this.
Wow.
We're the lucky ones. We get so excited when, there's a big deal in the room.
Right.
And
tall.
tall drink of water, if you will. Without further ado, Lisa, it's our honor and privilege to introduce Medical Director of the Emergency Room right here in McLaren, Flint, Dr. Ray Rudoni. Hello, sir.
Hello, good afternoon, ladies.
Hi, Dr.
Lisa,
Rudoni.
Nice to see you,
Yeah,
Kristen.
thanks for
Thank you
being
for
here.
having me here.
We are so excited to have you. You know, you're a friend of the show, and you
Love the
always
show.
bring amazing energy and amazing insight and content
Caffeine does
to
that.
us. Is that what it is?
Yeah.
Well, and I have to say, too, because coming from the emergency room, I love your demeanor. And the reason I say that is people are coming in and they're in crisis.
Right.
So to have someone such as yourself who comes in, did you have to craft that skill set, Dr. Rudoni, is
No
what I'm
question
asking.
about it. I think we all do in the ER. I mean, it's nobody expects to be there usually. Most people are scared, frightened out of their norm.
Right.
Okay.
Not seeing their doctor. They don't have other stuff with them most of the time.
Right. They're
Out
of their
your
comfort.
new faces.
Yeah, I think part of
Yes.
the art is getting people to feel comfortable to the best of your ability. Listen to them, and hopefully they'll trust you in a few minutes after you get a chance to meet one another. There's not a lot of time to establish rapport,
Right.
as they say. You know, sit around and just in chit-chat. You got to get right down to it.
You got to
So
assess
there's-
it quickly.
There's a skill set that's involved.
You have a
and I
couple
think-
minutes to make someone feel very comfortable and trusting with their life.
Yeah,
with you.
absolutely. You've
Yeah.
got to be able to listen, and you've got to be able to ask questions at the same time. And, it's an art. It takes time, and some people are better than others, but part of being in ER is trying to learn that skill set, and it takes time.
How long have you been with McLaren Flint?
So, you're making me feel old now. It'll be 17 years this October.
Considering, Lisa, he's only 29.
Yes.
28.
Child.
Close.
Wow.
Yeah.
Well, and I think you're absolutely right. You come in and you've probably spent years, if you've coming in panicky, they're going to feel that vibe. So you come in with a calm demeanor, assess, but you move in a fashion that's rather quickly,
Absolutely.
Given what they're going through.
That's right.
So let's talk about this a little bit too, Lisa. I mean, you have kids, we have kids, probably spent when they were babies, like my first reaction is let's get this child to the ER, a fever, ER.
Everything.
A cut,
Right.
ER. And that, with anything now, as we're aging as well,
Right.
ER. Tell us, Dr. Rudoni, when shouldn't we head to the ER?
And if I had that answer perfectly spelled out, I'd
You'd
be living
bottle
in
it?
Maui. We'd
You'd
be doing
bottle
this
it?
from Maui.
We'd be doing this right.
You
We
know?
are in Maui.
Yeah, and I think that's a tough one, but it's a good question. It's a fair question. I think that a lot of times people come to the emergency department because they just don't know.
Yeah.
That's right.
And we see a lot of patients, for example, that show up with chest pain. Everybody thinks they're having a heart
Yes.
attack.
That's right.
One of the most common reasons people come to the hospital. And once we tell them it's not a heart attack, maybe it's a bruised muscle, maybe it's a bronchitis or a little pneumonia or something else that's not their heart, they don't know what it is till we tell them.
That's right.
Or we work them up, do some testing, then when we have some answers. Patients come in with complaints, and they don't necessarily know. If they had the answers, they wouldn't show up unnecessarily. So I think it's, if you know yourself, you know your children, something's not out of the norm, you can call your primary
there.
care doc, get some advice, but if you're not sure, you should go to the hospital.
Yeah, but I think that's a great point to call your doctor first. Get some, if
Yeah,
they're
if you
available. A
can,
lot of
sure.
times there's that 24-hour
Absolutely.
after hours.
Especially now, and there's a lot of opportunity, even more so now, for more of a connection with your primary care
100.
physician. It's not just a 9 to 5 anymore.
That's right.
Yeah.
And they're on call, and,
Yep.
and they know you, and you
Yep.
know them, and they have a sense for what you're asking and how you're asking it. They usually know your medical history.
Right. Yeah.
And so if you say certain key phrases or certain symptoms, they can say, you know what, I don't think there's a problem. We'll see you tomorrow.
That's right.
Or why don't you go get checked out and have them call me when you get
Right.
there.
Or possibly now we have the other options of clinics, after-hour
Yes.
clinics. So
Yes.
if you're sick, or you can probably get prescription meds on site. If it's after hours, there's a lot of options, and it's
Yeah.
good to know we have that.
And actually, we offer a service at McLaren Flint most of the day and evening, which is called a fast track, which is you come in through the emergency department, you're seen by a nurse, and if you have a minor ailment or illness or injury, we can usually get you taken care of in 90 minutes or less. And you can even go online and register for that visit for the fast track area only if it's a minor injury or ailment. And when you come in, we'll be waiting for you. We'll take you right back, and we should have you out in 90 minutes with testing.
That's great.
Wow, that's incredible. McLaren Flint.
Yep.
You know, and McLaren Flint, having been born and raised in the city, I mean, my goodness, Dr. Rudoni, look at the growth, the exponential growth of that hospital as a conglomerate. I mean, it is just growing nationwide. There's
no question. The McLaren healthcare system, since even when I started here 17 years ago, seems like it's grown 10 times from what it could be more than that. They have some work being done in different states now. They're branching out across mid-Michigan. You know, their affiliation and ownership of Karmanos Cancer Institute.
Huge.
You know, we've got the insurance company through McLaren, all the subsidiary hospitals and clinics, and I'm sure I'm not naming everything, but they have really grown, and they've done a good job. They've got great leadership.
And vision.
I'm very proud to be part of it. I'm very proud to be part of the company that's growing and doing so well.
Well, I think they're also lucky to have you. I think you probably operate in tandem in seeing the growth and in working with them. But what else I think is fascinating for you to speak on is from 17 years ago to where we are today, the technology and what we're able to do.
Day and night.
It's what a day to live in. You know, we talk about, the good old days, right? But what incredible times, Dr. Rudoni.
It is pretty amazing. And some of the things we're doing at the hospital now, I never would have imagined. You know? And again, I don't want to get ahead of ourselves here, but just look at the treatment for stroke that we're doing now. We're
incredible.
You know, we're treating patients within 30 minutes with stroke clot buster medications.
The robotics and the telestroke.
Yeah, that's part of it as well.
Is part of it, and it's that really when in the beginning has been a leader nationally for McLaren, which is something definitely here in Michigan. Definite leader here in the state also.
We have specialists on call 24/7, 365 that can do certain procedures for certain stroke patients that can help them walk out of the hospital, help get their speech back, help send them back to work. And if you go into any McLaren subsidiary in mid-Michigan and you have a stroke symptom, we can get you on the robot from a different ER and pipe you right into these guys and gals
from other
and they
places.
can help
it's
make treatment decisions right there
and
on the camera.
You move in lightning speed to
you
get
have
this
to,
you have to with that.
That's right, because stroke is
absolutely
is brain tissue, and you got to treat it as quick as you can.
And looking for signs of a stroke, it's FAST. What does FAST stand for?
Well, you know, FAST is kind of a mnemonic that we like to use for things that have to do with facial weaknesses, problems with the way the face looks, maybe some drooping. There's abnormal.
Why are you looking at me, Dr. Rudoni?
Well, you do not look like you're having a stroke,
you just
Kristen.
Make me nervous.
Lisa.
Thank you, Doctor.
Abnormal
you
speech.
You heard it here first.
You got it. Abnormal speech and weakness on one side or the other are primarily the big three that we kind of look for.
Mm-hmm.
Yes, I mean there are others.
Sure.
There are others that kind of mimic certain other things that people don't think could be a stroke, but we have to be careful not to overcall it. But speech, weakness in the face, weakness in the arms or legs, headache in that scenario, you got to activate 911 and go to the hospital.
Got it. And do you see a lot of stress-related stroke symptoms, like people who think they're having a stroke? It could be stress-related.
Anxiety attacks.
No question. Anxiety can cause anything.
Yeah. This is a
but
big
again,
deal.
we can't call it anxiety till we've proven it's not a stroke. We've proven it's not a heart attack.
Right.
Okay.
We've proven it's not an infection.
You go through all that testing
quickly,
rather quickly.
Right.
And, you know, like you said, McLaren's benchmark in stroke recovery and stroke treatment. And, you know, what do you attest that to? I mean, it's just years and years of dedication, and just you own that category here.
Well, I
Michigan.
like to think we do. I mean, again, we're offering services that many other places do not. We're showing improving outcomes that are that I would never have imagined could have occurred. And I think the hospital had a vision several years ago when they put their stroke service and team together, was a need for our community. And we had the resources, the science was growing, and they decided to incorporate it and offer a service. And I think it's done a lot of great things.
I think so.
For
I think
a lot
you've
of
saved
people
lives
in our community. A
and
lot of people have benefited.
You know, we're hitting the aging baby boomer demographic. Flint is a big city, an aging city, but there's also demographics we hit in terms of maybe not the best numbers of obesity or diabetes. And, you know, I think, though, the key is prevention and education, and McLaren is key in that.
Yes.
I mean, you see it on the daily basis.
Yep, absolutely. And we continue to do reach out programs and educate the community. And, patients that come in receive all kinds of counseling for rehab services, dietary
Right.
changes, smoking cessation, exercise programs. All this is part of recovering after this kind of
And these
of-
are
of an
successful
injury.
programs.
Yeah,
These are very
absolutely.
successful programs that you offer, and they're open to everyone in the community
Sure.
to come in and be a part of that. And I know that we definitely here, we have talked so much about epidemics and crises that are leading causes for so many other things, and one of those being the opioid
Oh, yeah, it's
crisis here.
terrible.
Yes.
So, and I know that you can speak to
Yeah.
that.
It's a national problem. It's
Sure.
a state problem. It's a community problem, and it's not just in Flint. It's around the country. It's in a lot of major cities, and we certainly are feeling it here in Genesee County. I can speak, I think, for my colleagues at the other hospitals in our community that we work with, that the number of patients that we're seeing seems to have dramatically gone up, and the work that the paramedics, and we've got a wonderful crew of pre-hospital providers in this county, paramedics, the county paramedics, all the ambulance companies, the people that are out there saving lives with Narcan every single day. The numbers continue to grow, and we can't get to everybody. And unfortunately, we lose people every day, and it's a devastation, and it's really bad.
You
It's
know,
getting worse.
I think, too, it doesn't, like you said, it doesn't discriminate. It crosses race, religion, color, socioeconomic lines, and we've all had, like I've had it in my own backyard with family that you would have never predicted, right?
Right.
You look at what people are going through. Really, I never would have thought.
Right.
We don't know. And I think for you being in the trenches and you see it on the daily basis, it's devastating, and the numbers are only upticking. So it's something we've got to stay on top of,
Yes.
because it's not an easy fix.
It's not an easy fix, and I know that there's education being done from the schools, all the way through high school. They're talking about this now. There's counselors, there's state-funded programs to help people with this problem.
Mm-hmm.
But the opioids are one of the most addicting substances known
Yeah.
to man, and unfortunately, people get into them and they can't get out.
can't.
It becomes
That's
a
right.
vicious cycle. And
Right.
whether you're an inner-city person in a city, or you're Prince or Tom Petty.
Yeah, doesn't
Who
matter.
we buried in the last 3 or 4
Right,
years.
right.
It's terrible. So it does. Your point's well taken. It does not know just one socioeconomic status. It's everywhere.
Right. So here in the city of Flint, Kristen and I, we were discussing this. There is a billboard that says everyone should carry Narcan.
Yeah.
How do you carry that? How does someone like Kristen or I, where if we
We're
want
lay
to,
people,
we're
right?
lay people,
And
how
we suspect
how
an
do we
overdose.
access that to be able to have that? How do we do that?
That's a great question, because it's one thing to give a directive,
Right.
and we see it,
How do
and we
we-
want to be active.
We want to be active.
How do we get
want to
access
serve that
to
call
it?
to action in the community if needed.
Thank you.
If you take lessons from the pre-hospital providers and the medical first responders and people that are carrying this, primarily a spray that they can put up in
Their
people's
nose.
noses. It's
Okay.
one of those things that doesn't involve having to start an IV or having to get
Or-
a needle.
yeah.
You look at somebody, you think that's what they got, and you squirt some of this Narcan medicine into their nasal passages, and usually it wakes them up and makes them breathe again. But the problem is there's just not enough of that to go around.
Right.
And I think the key is, along with education and counseling and trying to get people out of this, is trying to treat the disease as well. But we're treating
The
it now.
root
We need
cause.
to prevent it.
Okay,
and
preventative.
it's not easy. It's easier said than done to try to get the drugs out of any community. But cutting off the flow of drugs, I know it sounds
It's hard.
easy. It's
It's
extremely
not.
difficult.
Yeah.
That you're looking at pain management, and you're looking at people who are severely, if they, correct me if I'm wrong, because I'm not a physician, but you're looking at pain management from a point where they sometimes can be suicidal. It's so difficult. So
Yes.
you've got to treat the pain, and with that comes a big risk with all of it. And then you see also probably at the root causes, there are mental health issues going on.
Sure.
So they're taking it, they're self-medicating with it, and they're getting their hands on it. And then you're looking at the medical society, which now is being so regulated with it. So they're not getting it. They're coming in to you.
Right.
They want to get it. You will check your database and
Yeah.
software. and you'll make a determination. And if they're not getting it from you, they're going out on the streets, they're buying it, and if they can't afford it, it's transitioning, as we know, to heroin.
To heroin. That's right.
You did a great job summarizing it, in my opinion.
Yes.
And don't get me wrong, there are clearly people out there who have indications for these medications. There's
That's
no
right.
question about
Sure.
it. So, the problem is the fine line between giving people the pain medicine that they need
Right.
and monitoring it and making sure they're using it appropriately versus giving it or dispensing it at times in people that don't need it.
Right.
And there's nothing, it's one of the challenging things of being in the ER is you want to help everybody.
Well, that's what I'm saying.
But
you
on
have
occasion-
that hypocritic
on
oath,
occasion
and
you
you
get a
want to help and
situation where-
serve, and
yeah.
you have to assess. And I know
Yep.
you have a big heart.
Right.
It's a difficult. I mean, kudos to you, Dr. Rudoni, because you have that oath to heal, and yet you see what you see.
Yeah, and on occasion it becomes it's an argumentative situation with some patients, and I mean some. It doesn't happen all the time. But
Sure.
you can't give everybody everything that they want.
That's right.
Yeah,
That's right.
You got to keep people safe. First, do no harm. That's what they say.
That's absolutely right. Well, we will table this because there's much more
So much.
conversation,
So much, yes.
with you, Dr. Rudoni. So thank you so much.
Mm-hmm.
So let's shift gears a little bit. And, we talked about when to go to the ER, why to go to the ER. How about how you get there?
Yeah, well, it's interesting. If you look at our data every day in our department, we see about 40 to 50 ambulance patients who arrive, and we see about 175 on average patients a day in our ED. So let's say that 1 in 3, 1 in 4 come by ambulance. Those are the people usually that are the sickest or that don't have transportation or that
Sure.
are really ill or somebody else is calling on their
Yeah,
behalf.
on their behalf, yes.
And the rest of the people walk in or drive their own cars. Some people bring their bikes, believe it or not.
Right.
But, a couple of things to think about. If you're going to the emergency department for whatever reason, take a minute and bring a couple things with you. And I know this sounds odd, you're packing to go to the hospital, but bring your identification,
Okay.
your driver's license, your insurance cards, and bring a list of your medications.
Right.
Okay.
And bring a name or a phone number of your doctor or doctors that are taking care of you. A lot of people come in, they're scared, they're concerned, I get it. But sometimes they, in the heat of the battle, they leave their medication list at home.
Right.
They don't remember the name of their doctor. Maybe they just saw him or her for the first
It's
time.
new. Right.
And having that kind of information, it's not always at our fingertips in the ER.
Which you think it is. Don't
Right.
you have one database with
well,
all
we do,
of our
but,
stuff?
but it's not
But
always up to
sometimes
date.
it's not accurate.
Right.
Yeah, and some patients, might show up at McLaren for the first time, have never been here before because they've gotten their health care elsewhere.
That's
Right.
right.
So if you have a moment, grab a few of those things.
That's
And if
very
you're sending a
important.
loved one in an ambulance, grab their things of that type and follow them along just so they have a little bit of information. Just a few quick reminders that might save people some time
Right.
during their evaluation.
That's the most important thing. That's the most important reason also is to save that time.
Yeah.
Yeah.
And then because you may receive a bill, right, after the
right.
fact, and you're like, I have health care, saves you time.
Right.
So very good. Okay, a couple more things real quickly.
Sure.
Let's talk about, the flu. We had a
The
late
flu.
flu season.
And pneumonia. There's pneumonia shots heavily being handed out right now.
Well, you can always get pneumonia shots.
Yeah.
There's no question. There's certain people at certain age groups who qualify for the pneumonia shot. I think this year, in my experience, we're seeing flu now.
Yep.
It's a later flu season.
Yeah.
Why is that, Dr. Rudoni?
You know what?
The
It's just-
polar vortex,
Gosh.
the Arctic
Is that why?
air.
Yeah.
What do
know
you
what?
think?
It's hard to say. I mean, again, if you look at the flu every year, it comes at different months at different times. I'm not sure why it comes later some years and earlier some years. And I wish we had time to prepare, but we don't. But right now, I think we're kind of tailing off from the peak flu season in our county.
Dr. Rudoni, are we coming into the spring and summer? Please.
It's almost
please,
pollen season.
Please.
It is.
From
Oh, I
flu
can
season
feel
to
it.
pollen
Yeah.
season.
It's
Yeah.
a treat, isn't it?
Yeah,
Yes.
lovely.
Very fun. Okay, now let's end on somewhat controversy. Let's talk about, are you seeing some measles?
Yeah,
Are
the
you
measles.
seeing,
Yeah.
this is getting the people, I'm
This
looking
is
at
getting
social.
a lot of people, CDC, this is getting a lot of people
lot of
in an
attention.
uproar.
Yes.
Yeah.
What are your thoughts on the measles, the vaccination? What are your thoughts? Give me some insight.
Well, again, I think that right now, I don't think we've had any cases of measles that I'm aware of that came through McLaren Flint, and I don't know about my colleagues elsewhere in Genesee County. I know Oakland County has seen some cases. I'll speak as a dad and a doctor.
Okay.
And I have two daughters.
I like
that
both sides.
I immunize from day one. I'm a pro-immunization advocate, whether it's the measles, the mumps, the rubella, whether it's HPV for young people, whether it's influenza. I'm pro-vaccination. I know there's some people out there who are not.
Right.
But I think, this is a perfect reminder for all of us that, speak to your primary care doctor, stay on your immunization schedule, start your children off when their pediatricians suggest it.
Okay.
And this will minimize your risk of being exposed to one of these devastating diseases that we had thought we had eradicated.
But have not.
But as you can see,
And
that's all it takes.
and I will, just play the other side on that a little bit, is with the HPV, I have held off for both girls.
So have I.
So, but not that we won't talk,
Correct.
not that I won't do research,
Yeah.
which I have and read and will continue to read and learn and grow. And I have a 21-year-old daughter who now takes care of her own medical needs, though she still calls me for the dentist or something, weaning that off. And now it's her choice. But, I'm listening to you and I hear you, and I have a almost 18-year-old. So, you make those personal decisions. And to know that you're an advocate for them, is
Absolutely.
it's comforting as well.
But there's great resources out there. You shouldn't have to guess. Your primary care physician, family doctor, pediatrician, they have the resources we all need to make educated decisions.
Right.
Absolutely.
And I think we need to ask our
Personal,
healthcare providers
educated.
for that.
Yes, absolutely. So we appreciate that. We love you, Dr. Rudoni.
Thank you so much.
Yes,
you're welcome.
I learned so
information.
much. I
Well,
learned so much. Thank you.
I enjoy being here,
Yeah.
and it's great to see you both. I wish you continued success. There's a lot of other fun stuff to talk about. So, the
it's only
Tigers
the
are starting
beginning.
out. I'm fired up for the Tigers.
yeah,
and,
yeah.
and so that's a good time of year for baseball.
What do you think the season's going to look like? Pretty solid, or it's a rebuild?
It might be a rebuild, but it's still fun going down to the ballpark
Oh,
and watching
Detroit,
baseball.
baby.
And-
Detroit.
Yeah, I love it.
And the city of Flint, it's just growing, the economic growth downtown, and there's a movement. And
Yeah, we're going to see the Black Violins on Friday
Yes.
for the second
Capitol
time.
Theater,
Yep.
baby. And
Can't
then
wait.
you will be coming to Kaiba Health and Life. We'll be talking about innovation, technology, taking care of yourself, you're living your best life, prevention. But you will also be at the Hope for Flint studios as well, talking about the growth of the city. So we love you. Only
I'm
the
happy to be
beginning.
here.
Big thank you to Medical Director of the Emergency Room, McLaren
Lisa.
Flint.
Thank you so much.
Dr. Ray Rudoni. Big thank you to my beautiful co-host, Lisa
Thank you.
Metropolis, and I'm Kristen Wolosinovich. Big thank you to our
Thank you.
listeners and viewers. This has been Kaiba Health and Life.